Well, there is no reason to be unhappy with your love life. If erectile dysfunction is getting in the way of a fulfilling physical relationship with your partner, patient care advisor from Flagstone Medical, Bill Jeffries, is here with some good news for everybody. Bill, nice to have you back here again.
Thanks, Alex. Good to be back.
Such a pleasure. So, of course, you've mentioned in previous segments that ED affects about half of men over the age of 50, so it's fairly widespread. Now, let's talk about exactly what causes it, because frankly, I don't think people discuss it enough.
This is true. Basically, ED is a blood flow issue. The problem occurs as we age and we can see here, this is the culprit right here, this plaque buildup that just naturally forms in our blood vessels. Yeah. Yes, as we age. And what it does is it constricts the blood flow and just inhibits proper erectile function.
Okay, and you know the breakthrough treatment, of course, of Flagstone Medical is something called acoustic wave therapy, which people think, well, that sounds pretty futuristic. What is it?
What it is they're acoustic energy waves that break up this plaque and just restore the full diameter and just gets rid of the blockages that occur that inhibit erectile function.
And this is significantly different than the traditional methods that we think of. You know, pills, painful injections, there's none of that that's necessary with this.
That's correct.
So talk a little bit more in depth about what it does.
Sure. The way the traditional medications work is they attempt to dilate these blood vessels to have more blood flow. Our approach is let's get rid of the blockages. Let's restore function naturally.
Got it. And what do you say, you know, to a guy that's been to his doctor before and maybe hasn't had much luck with getting this condition treated? What would you say to them? That there's hope?
There is definitely hope, and I hear this a lot. You know, a guy will go to his doctor, and his doctor will say, hey, you're 60 years old, you're 70 years old, you know, it's just, you're going to have to live with it. And that's just simply not true anymore. We have this technology, and we can fix the problem. All due respect to those hardworking doctors that have to, you know, cover the whole gamut of physical experiences and medical issues.
Right.
You know, they just need to go out and look at the research. There's volumes of medical research that's been done on acoustic wave therapy. It's been proven effective, and it does work. It's not the life sentence that it used to be.
Right, exactly. And the truth is, Flagstone Medical, too, is specialized in this. That's all you guys do. And so, of course, if someone goes there to be treated, what's the experience they're going to have? Because this is something a little bit challenging to talk about at times. Even opening up to your partner can be a challenge. So what can they expect with the experience?
One of the things that I hear from guys all the time is that you know, I never really talked to my doctor about this because I just felt uncomfortable. Yeah. And there still is a stigma attached to erectile dysfunction. As you mentioned, all we do all day, every day is treat ED issues. We have an all-male staff, which makes patients feel comfortable to come in and talk to us because this is our specialty. They're not going into a general doctor's office where, you know, there's a lot of different maladies being treated.
FDA approved, of course, so we know that it's safe to use. And, you know, there's a lot of people in town this time of year who may not live here all year round. Is it feasible for them to actually have this procedure done if they're here now and won't be, say, in a few months?
Sure, absolutely. The treatment therapy that we provide can last anywhere from a few weeks to maybe a couple of months if it's a more, you know, severe case of ED, but it's perfect for those seasonal visitors to get their treatment while they're here and go back home a different man.
Yeah, different man, a happier couple as a whole, because it's one of those things where if you just kind of let it be, it starts eating away at not only you and your self-confidence, but also your relationship, right? So addressing it head on, talking to your partner about it. What advice would you say to couples out there to open up and start having this dialogue?
Well, first thing is to just understand that it is a medical condition just like any other medical condition, whether that be diabetes or heart disease or a broken arm or the flu. It's a medical condition, but it's a medical condition that we can treat, and if left untreated, it can get progressively worse. It's not going to get better on its own, but we do have the technology to reverse.
Right? Intimacy is one of those, you know, human things. We all crave it. We all need it, especially a healthy relationship. It's important to have that connection. And for those who've been struggling with this for so long, finally there's something they can turn to sort of get beyond it and start having that relationship that they've been wanting or that they had before. So it really is incredible technology. Always a pleasure to see you and have you on and learn all about it. Thanks.
Thanks, Alex.
Nice to see you. And you can get a free physical exam and consultation if you mention the Morning Blend. That's $199 value. If you want more information, visit flagstonemedical.com or call 520-600-4405.